We work in a lot of places that are very remote or unstable because of conflict or just under-resourced in general. Almost never do we have CAT scans or MRIs. But we still need to be able to diagnose patients with some type of imaging. Classically, people think of ultrasound as something that they had for their heart, or women who are pregnant have an ultrasound with what we call point-of-care ultrasound. We can use small portable machines and teach our non-expert staff, so people who are not cardiologists or radiologists, how to use ultrasound right at the patient's bedside. So they can take a look at the heart or the lung to see if there's any problems. They can look at the abdomen to see if a patient with trauma has any bleeding inside the abdomen or needs surgery. The main benefit is to our patients who now have access to better, more accurate diagnostic. But the other important benefit, it allows our staff to be able to improve their own skill.
Okay, I'm Esbon, one of the clinical officers in MSF Agro Hospital.
And I'm here almost like 3 years and 2 months. I'm working as a clinical officer. What we do normally is we do consultations, especially the consultation of patients, both in-patients and outpatients too. I was observing from one of the MD who was here. He was doing an ultrasound, and one day we were involved with him in ultrasound on a patient who had a trauma. It was an accident, a car accident. One of them was very sick, that he was having distress, and we couldn't figure the cause of the distress physically by examination and other things. Every 30 minutes we would do an ultrasound on him, and what we found was that there's kind of free fluid being accumulating in the space between the lungs. So what I think was he was actually having an active bleeding in that particular space. It was by the bedside and it was very effective. We didn't have to look for a radiologist at that particular moment. Even in our situation here, to find a radiologist is actually very, very difficult. Then it made us to make a very clear decision. That was the time that I got really interested in ultrasound, that if ultrasound can really help us in this kind of situation, I think it's very worth that someone should actually try to learn ultrasound training, which is very, very important for me.
Over the last few months, we've been working in South Sudan to implement point-of-care ultrasound in our projects and teach our locally hired staff in Awil, in Agak, and in Malakal. One of the strengths of MSF is our locally hired staff. They are the vast majority of our clinicians in almost all of our projects. For example, in South Sudan, they're more than 90% of our clinicians. They are incredibly talented, incredibly brilliant, and some of them may not be doctors because of interruptions of their medical education and work by war or by outbreaks. But because of these simplified ultrasounds, they can now have greater independence and are empowered to make more clinical decisions on their own.
This is not very easy.
No, it's not so easy.
I think it's really very difficult because I tried to see the images, I could not be able to find anything. First of all, usage of the device, how to hold the materials and all these things is really very difficult for me. So I was thinking that it's really going to be impossible for me to learn the ultrasound itself.
Briefly, this is a 65 years male, a known case of liver cirrhosis. So he came with a lot of abdominal pain and distension, so we are quickly going to examine him. I'm going now at the subxiphoid area. So to look for if there's fluid between, in the pericardial space, that's the space around the heart. So ideally there should not be much fluid, there should not be fluid there at all. So I'm going to look for that. So the heart, the pericardial space looks normal, there's no fluid in the pericardial space.
With the support of the technical person, that is Dr. Adi, I really found it very, very easy for me because it was really practical. It is really very, very practical. And now I found it that within the 2 weeks I've been using the ultrasound, I've really coped up very fast. I was able to also examine some few TB cases, tuberculosis, yes, which made my work also very easy. For sure I will use, and I really wish I could practice much so that I can really become more perfect in the exams that I have learned already. If I learned ultrasound very well, it will help me in my diagnostic process.
We're definitely following each of the trainees over time. Even after 1 month, we see that some of them have very high skill, and we're seeing how many ultrasound exams they do each month, plus how it's helping them make better clinical decisions. We really want to identify some of the best clinicians in these groups, and there are lots of them, who can take the lead for ultrasound in their own hospitals so that they can move ultrasound forward in upcoming years.
So if I can learn things and do it by myself, I think it will be really very grateful for me to give my patients quality care that they need.